what can I help you with?
So I have an appointment at 11:25, and I made sure to come in 10 minutes early.
All right, we'll help you whenever we can. We're really booked out today, so you can just go ahead and take a seat. Hi, Beth. You can come up now, fill out these, take a seat. Thanks.
Here you go. I filled it all out.
No, keep those for the hygienist. Thanks.
Five hours later.
Eva? Yeah, we're ready.
Right in there. Here's my paper.
Yeah, we don't even need that. So we usually do start with vitals, but since we're running so far behind today, and you seem like pretty healthy, we'll just get right ahead to it. We'll hop straight to the EO/IO. So we're just gonna dive right in.
What are we doing?
Oh, don't worry about it. It's a lot to explain.
Okay.
Yeah, it appears you have periodontitis. We're gonna need to go ahead and take some x-rays.
A few moments later.
Yeah, so your x-rays show that you do have periodontitis, probably because it's been like 5 years since we've seen you. We're gonna have to do an SRP, all 4 quads. We'll have to reschedule you because we're way too busy to take you in right now. Just tell the receptionist out front that you need to reschedule your appointment. Have a good one.
Do you need to reschedule?
Hey, welcome in. I can check you in over here.
Thank you. I have an 11:25 appointment with my hygienist.
Thank you so much for arriving 10 minutes early, Courtney. I have these forms for you to fill out. You can fill them out and they'll be out shortly.
Here you go. I filled it all out.
Very nice, Courtney.
Courtney? Oh, hi there. Come on back. How are you today?
Doing great. Thank you.
All right, Courtney, go ahead and have a seat.
Okay.
Thank you so much for coming in today, Courtney.
Yeah, thank you for being so timely. I really do appreciate it.
Absolutely. Let's go ahead and dive right in then.
Okay,
Courtney, I'm going to go ahead and do your vitals
Oh,
today. Make
okay.
sure we're okay to go on with treatment. Is that okay with you?
That's totally fine.
Perfect. We're going to start with blood pressure and your pulse.
Yeah. Okay.
Let's go ahead and put this little cuff on you. Okay. Go ahead and lay it over your chest.
Okay.
All right, Courtney, so it does look like your blood pressure was 119/79, which
Oh,
is
great.
awesome. The normal range is anything below 120/80.
Perfect.
Your pulse was 70, which anything between 60 and 100 is also great. And your respirations came back at 14, which anything between 12 and 20 is normal. So you are looking good today.
Awesome.
Do you have any other questions before we move on?
I really don't. Thank you for being so informative. I do keep up on like my blood pressure and stuff, so it's really nice to see it be so accurate here. So
Awesome. All right, Courtney, I'm just going to go ahead and enter your vitals into our system so that we keep it on record.
perfect.
But that is great that you like to stay involved and informed regarding your health information. I'll make sure to do my best to keep up to date and informed on anything that's involving you or your health. Now, if it's okay, I would like to move on to do something called an extra and intraoral examination. During the exam, I'll be observing and palpating areas around your head and neck, as well as around and inside your mouth to check for any signs of cancer or other abnormalities. Is that all right with you?
That's totally fine. Yeah, that sounds great.
Perfect. Okay, Courtney, so your extraoral exam looked really great. I didn't see anything out of the ordinary. As for the intraoral exam, I did see some swelling on your gums as well as significant bleeding. What are some changes you've recently noticed with your gums?
Oh yeah, I actually have been noticing when I'm brushing and flossing, there is quite a lot of bleeding almost every single time I brush actually. So I was concerned about that, and is there anything that I can do?
I understand you're concerned about the health of your gums, and I plan to make it a priority to help you heal and no longer be in pain, Courtney. In order to create an action plan for you to follow, I'm going to need to take a full mouth set of x-rays, which is going to contain 18 images so I can see exactly what the severity is. Does that sound okay?
Totally, yeah.
Awesome. Okay, Courtney. So I'm going to go ahead and show you what normal bone level should look like in an x-ray. You
Okay.
see here it kind of comes down roughly this far on each tooth, okay?
Yeah.
Let me click over and find yours. Now if you look right here in yours, your bone level is pretty far up.
Yeah.
This is actually showing moderate bone loss.
Oh.
And that is caused from periodontitis, which you do have periodontitis, which periodontitis is a serious gum infection that can damage gums and destroy your jawbone.
Well, how did this happen to me? I have never had this before, and all of a sudden you're saying that I have bone loss? I brush every single day. I just really don't understand.
I understand that this can be upsetting. You feel like you've been properly brushing, and now out of nowhere, your x-rays are showing some problems. Periodontitis is actually very common in adults. In fact, there are at least 3 million cases per year in the US only. The good thing is, we are going to be able to create a plan that is going to help you get back on track and feel much more comfortable. We will put in place goals for you so we can measure the success of our plan.
Okay, thanks. Where do we start?
I need to get a better idea of your habits, so I'll start by asking a series of questions that will help me better understand what we need to change. Okay, Courtney, I'm gonna go grab a chair so that I can sit down and really explain this to you, okay?
Okay.
All right, Courtney, here's what I propose that we do. We'll start off by getting an electric soft bristle toothbrush. This will be effective because it will be more gentle on your gums and also do a better job cleaning them. I'm going to send out a referral for you to get your vitamin C levels checked again. Vitamin C is crucial for healthy gums, and if you are deficient, that could play a big role in what's contributing to your periodontitis. I'm going to prescribe you Prevident, which is a toothpaste that will help aid the healing of your gums and decrease sensitivity so you can get back on track with flossing regularly. And lastly, I would like to plan to do an SRP, which is basically a deep cleaning that includes scaling and root planing. This will remove any bad bacteria that are hiding below the gum line and allow your gums to have a healthy environment that they can properly heal in. After the SRP, I would like to schedule you back in 3 months so I can see how your treatment plan is working and make sure that some of this inflammation is going down, as that is going to be one of the biggest indicators that things are healing like we want them to. Does that sound okay?
Totally, yeah.
And I will actually print all of the instructions out for you so we won't miss any steps, okay?
Okay. Yeah, that sounds great. Thank you for explaining to me the purpose of each step in our plan. It's helped me understand the purpose and importance. I will make sure to follow these instructions and look forward to seeing you at my 3-month checkup.
Right, excuse me.
Oh yeah, I really was noticing that when I'm brushing and flossing, I'm bleeding quite a bit. Wait, hold on one second.
Now if you look right here in yours, your bone level is pretty far up.
Yeah,
This is actually showing moderate bone loss.
Oh.
And that is caused from periodontitis, which you do have periodontitis, which is
Go.
Okay, Courtney, here's what I propose we do. We'll start off by getting an electric soft bristle. Fuck that.
Hey, welcome in. Wait, what do I say? Thank you so much for coming 10 minutes early. Please fill these out, and your hygienist will be with you shortly.
Action.
Okay, Courtney, so your extraoral exam looked great. I
Oh,
didn't find
awesome.
anything out of the ordinary. As for your intraoral, I did see a bit of swelling in your gums and a significant amount of bleeding. What are some, cut.
That hair flip though. Yo.
That could be a blooper.